So I always like to begin our interviews with name, last name, and then title. What do you do?
Sure. My name is Jose Campo Maldonado. I'm an infectious disease physician. I am an assistant professor for UTRGV School of Medicine. I'm part of the internal medicine department.
We reached out to you today to talk specifically about coronavirus. We know there's a lot of interest from the community to learn about it. What is it? Let's just start.
Sure.
Okay.
Sure. The coronavirus is one of many viruses that can circulate in the community, but I think your question is directed probably to the recent novel coronavirus 2019 outbreak. Mm-hmm. Because I just want to emphasize that we do have coronaviruses circulating in the community. But those are usually cause only mild illness like common cold. But what is special about this coronavirus that is of concern for public health is that it's new. That's what is called the novel coronavirus, and it has caused a major outbreak, mostly in China, right? Although it has been documented in other countries too. We know that probably this virus moved from animals in live animal market in Wuhan city. That's what we know so far. And then it jumped to humans, which is difficult for that to happen because this coronavirus also can infect animals. But it's not that easy that it goes from animals to people. But what is thought to happen is that it jumped, and then those people got sick, and like it was a new virus, and people didn't have immunity. Then people are getting sick, mm-hmm. right? There have been more than 7, I checked this morning, and the updates I saw is that there have been more than 7,000 confirmed cases, mostly in China. Mm-hmm. And there have been around 130 deaths for that virus. Those are the cases that are documented. That means that they were tested, and we know they got the infection. There are likely many more cases for people who didn't get tested, mm-hmm. But those are the estimates, so that the actual numbers that we have right now. We do have 5 confirmed cases in the United States, none in Texas at this point. And those confirmed cases have been from travelers. Mm-hmm. So for the community, the important things to know is that right now, and things can change over time, of course, but right now what we know is that we don't have local transmission of this virus in the United States. So if you get sick with the symptoms of a common cold or a pneumonia from a virus, it will be more likely to be other infections that are currently circulating, including the influenza virus that we are just still going through the cyclic outbreaks that we have every year for that virus. So it will be more likely to be that unless you have traveled to that area where there is transmission of the virus, mm-hmm. and we are talking about the area around Wuhan and other cities in China, or you have been in contact with someone who is known to have the infection with that coronavirus, and that's more likely at this point in time in the US to have been a traveler. So if you haven't had any of those exposures and you get the symptoms, likely you have an infection from the community.
What exactly are those symptoms that people need to look out for? What separates it from a cold, from some sort of...
The problem is that right now there is not a clear way to differentiate that clinically. So it's mostly by travel and exposure that you identify people who could be having this infection. But really, the symptoms look like symptoms that the flu can cause, like cough, fever, body aches are some of the symptoms that I saw described in an earlier report about symptoms that was published in the Lancet mm-hmm. of Infectious Disease. Mm-hmm. Those were some symptoms that were found in some of these patients, but my thinking is that it could be there could be a wide spectrum of illness, from people who have a very mild illness to people who have a very severe illness with the pneumonia caused by the virus. So there are no symptoms that I can tell you when you have that you really know that you have the coronavirus. There is nothing like that, because it looked very similar to infections that you could get from other viruses.
What makes this virus dangerous? Like, what is the whole, why are people really concerned about it?
Yeah, we are concerned about it because it's new, so things can change. So we don't know everything about it. So some of the information I'm giving you is based on the initial reports that we had. So some of this could be revised in the future. So the unknown is always causing some sort of a feeling of being uncomfortable, right? Because things can change just because we don't know everything about it. Mm-hmm. Because it's new, we don't have any type of direct therapy that could treat it, and we don't have a vaccine, although our government and other governments are working on this already. The other thing is that it's, our population hasn't been exposed to this virus. So there is not what we call herd immunity in the population, because even if you are not immune to a virus, mm-hmm. but the people surrounding you are, they are less likely to get it, so you are also less likely to get it. You are protected by other people who are immune, right? So that's what we call herd immunity. So that's not there for a new virus, because no one has seen it before. Their immune systems haven't seen it before. Mm. So that means that almost anybody can get it, right?
Is there, and I know it's still mentioning, going off a little bit about being relatively new, cause death, how soon, or what is the shortest time someone has gone from having the virus to death?
That's a great question, and I don't know the answer to that. I'm not sure what the exact, I know this usually happens within 14 days, but I don't think there have been published data about that, at least that I have seen. So that's something that we'll need to explore in the literature, see if there is any answer for that right now. I don't know the answer. Mm-hmm.
We'd like to ask a little bit about our community as well here in the Valley. Is there a plan, if there is, not just this particular virus, but any infectious disease virus that is in the community, such as this?
Yes, of course. Fortunately, we have institutions that collaborate at the national and local level. When there is any public health threat, the U.S. government gets involved, and there is the CDC who generates guidelines for this. But also they are in direct communication, and there have been on direct. I am aware that they have been on direct communication with the regional and local health departments to establish a plan that is uniform, a national plan and a national process. Because part of having a new virus is, for example, there was no way to test it initially. Mm-hmm. Now there is a process through the CDC mm-hmm. to send suspected cases to them to look for confirmation. And my understanding is they are also working to develop alternatives for rapid testing, so the virus can be tested locally instead of being centralized. Mm-hmm. But because it's a new virus, that's not in place, so it needs to be developed. But there is an aligned process of coordination between the CDC, the local health departments, and the local health department and the regional and local are communicating all together, following those standards. And those standards include understanding what the network is for healthcare, mm-hmm. communicating with healthcare providers, communicating with hospitals and institutions, including ours, mm-hmm. To make sure that we all understand what's the process. And we all understand what are the screening criteria if we have a suspected case, and how to manage and protect the healthcare personnel and also the public. Mm-hmm. So we have been in communication with them, and we are following and preparing to follow the guidelines if we encounter a situation like that here, which we haven't had any cases, but we want to make sure that if that happens, we are prepared, of course.
Before we move on, I know you mentioned testing at the local level, and by testing at the local level, you mean testing at the local, just to clarify for our audience as well, testing at the local level where the infections are found, not necessarily testing like locally here, Valley specific right now.
Well, testing at a local level, I mean that we develop the capacity to test in the same region where the cases are found. Let's say if in the future we have cases here that we could test here, instead of sending centrally to the CDC laboratories, if the health department could do the testing here in the future. Otherwise, if there are many cases, the CDC is likely to become overwhelmed, right? So, so they're thinking about this, is my understanding, and my understanding is they are trying to develop that capacity. But it's understandable that we don't have it because we didn't know about this virus until, I mean, the epidemic is thought to have started in December, and we started to learn about these concerns in January. So it's understandable that there is not that capacity is not available yet, but people are working to develop that capacity.
When it comes to this region, what challenges do you face? We do know there's a huge uninsured population here in South Texas. Is that something that worries you when it comes to people not reporting illnesses?
Yes, I do get worried about. That's what I think. We have been trying to be very forward in terms of informing the community, and we have released communications for the university, but also talking to you is a way to educate people. So we are concerned about that, and we want to make sure that people have the information they need to protect themselves from viruses. And we haven't talked about that, so let me briefly talk about it.
Sure.
So you need to try to wash your hands for at least 20 seconds, right? Frequently. Try to avoid touching your face. Those are things that can also help protect, and follow cough etiquette, which means instead of coughing out, you cover your face, not with your hand, but with cloths or with a tissue, so you are less likely to spread any respiratory infection, not just this coronavirus. And I think you highlighted the challenges. I believe that people being underserved, having less access to, in some cases, to education. In some cases, there are people who don't have what we call health literacy, which you may have education, but you may not understand about how to protect yourself from a virus. You may be an engineer, but you may not know how to do these things. So that's also a concern, and that's why we have been very forward in terms of providing education early on. So if we face a situation in the future for this or for other viruses, people are prepared.
What about, I know, and I may not be exactly the same, but you know, in 2016, 2017, we had some of the Zika virus. A lot of the concerns there were trying to find out if a patient is considered a travel-related case, specifically in a region where people go and come to Mexico basically on a daily basis, and they don't consider that traveling outside of the country. How do you guys kind of try to pinpoint that? Or not just you, but I mean the medical community?
That's an excellent question. I think that's a challenge that we have on this region. I think that's a threat in terms of the spreading of infections, because, I mean, for the Zika virus, it's different because it's usually mosquito bites, right?
Yes.
So it transmits in a different way. So this one is more concerning because it can be transmitted, we think it can be transmitted through droplets or contact when you touch your oral mucosa or your eyes, right? Definitely that will be something that I expect that the health department is also addressing. I wouldn't know the specifics about our border, the type of traveling that you're describing. Unfortunately, I don't have those details, but I think you highlight some important aspect that is unique to a region.
Well, anything else you'd like to say about perhaps you know, for the community that perhaps we haven't addressed at this moment?
Well, just to follow up on the news from official sources, including the CDC, the health department, trust the processes that are in place, and educate yourself about ways to prevent the transmission of the virus. We talk about not touching your face, we talk about washing your hands, we talk about staying away from people who are sick, not very close at least. And we also need to be truthful about our travel plans or contact if we are asked, or or if we think that's a concern, if we have traveled to regions where the infection is spreading, then we need to be truthful and bring it up to healthcare providers, call them in advance if you think that's a concern, so you can be evaluated properly, and then you are less likely to transmit this and this type of illness to other people.
Awesome. Thank you very much. Really appreciate your time.
Thank you.
Thanks.
I appreciate it.
Yeah.
Thank you.
Yeah.